Welcome to this space dedicated to the dissemination of scientific knowledge, designed for specialists, general practitioners, and students, as well as the general public interested in healthcare. In this edition, we present a detailed analysis of the study titled Pulmonary Hypertension Unmasking Unilateral Absence of the Pulmonary Artery in Congenital Scoliosis, a fundamental work for understanding the approach to this rare and complex vascular anomaly in adults. This research was published in the journal Mayo Clinic Proceedings by Dr. Ernesto Roldan Valadez, in collaboration with a distinguished team of specialists from national reference institutions in Mexico. Throughout this video, we will explore how the team analyzed the clinical, radiological, and hemodynamic characteristics of this condition, which represents a significant diagnostic challenge, especially when presenting in isolation or in association with chest wall deformities.
Legal disclaimer. This material is for educational and scientific dissemination purposes only. Its goal is to democratize access to the knowledge generated in specialized academic publications. Due to the dynamic nature of medical science, the information presented reflects the data available at the time of the original article's publication and may be subject to subsequent updates. Not medical advice. Under no circumstances does the information presented constitute a medical recommendation. The graphic resources used are only a representation of the article presented and are not completely accurate to human anatomy. For more information, you may pause the video.
All right, let's dive into a fascinating medical mystery. This is a case where a very obvious, long-standing condition was actually a kind of smokescreen, hiding something much, much more dangerous. It really is a true medical detective story. So, what is the connection between a curved spine and a life-threatening struggle for breath? Now, you'd think the answer is obvious, right? The spine is compressing the lungs. But, as you're about to see, the real story here is way more complex and honestly pretty surprising. Okay, so first things first, let's meet our patient. Her story doesn't start with some minor checkup. No, she's in an urgent crisis, and she desperately needs answers. So, we have a woman in her early 20s, and she's dealing with some really scary symptoms. Her shortness of breath is just getting worse and worse. Her skin has this bluish tint that's called cyanosis, and her fingertips are starting to widen, which is a classic sign called digital clubbing. Now, both of those things scream low oxygen. And as if that's not enough, her heart is clearly under a lot of strain, especially the right side. We're not talking about subtle clues here. This is a full-blown medical emergency. When you're faced with a puzzle this complex, where do you even start? Well, doctors usually start with what they already know. And in this case, the most obvious suspect was a condition she'd had her entire life, a pretty significant curve in her spine. It's a condition called congenital scoliosis. And just to be clear, this isn't the kind that often shows up in teenagers. Nope, this is a defect in her spine that she was born with, causing this really noticeable sideways curve. And at first glance, this makes a lot of sense. A really severe curve can twist the whole chest cavity, kind of like wringing out a towel. It physically squeezes the lungs, which means they just can't hold as much air. Medically, they call this restrictive lung physiology. And yeah, it could definitely explain why she's having trouble breathing. But was that really the whole story? The doctors had this feeling that something was off. The severity of her symptoms, the deep bluish skin, the signs of her heart failing, it just seemed like too much. It felt disproportionate. It was way more extreme than what you'd normally see with just scoliosis. And that mismatch, that feeling that the pieces don't quite fit, that's what told them something else had to be going on, something hidden. And this right here is where the case takes a complete 180. The medical team decides to use some advanced imaging, a CT angiogram, to get a better look. And what they found, well, it was the true culprit. A rare, life-threatening defect she was born with that had been completely missed for her entire life. Okay, take a look at this. Normally, your heart pumps blood to your lungs through two big arteries, a left one and a right one for each lung. Think of it like a perfect two-lane highway, keeping everything balanced. But in our patient, well, the discovery was just shocking. Her right pulmonary artery was completely gone, missing. It just wasn't there. It never formed. So this really paints the picture, doesn't it? If we go back to that highway idea, this is like shutting down one entire lane and forcing every single car to cram into the other one. All the blood from her heart was being forced through just the left lung. You can just imagine the backup, the pressure. It was a massive physiological traffic jam. So the mystery of why was solved, but the really hard part was just getting started. Now the team had to figure out exactly how much damage this was doing. What kind of toll was this taking on her heart and that one single, incredibly overworked artery? To get those answers, they needed to do a procedure called a right heart catheterization. Now, it's pretty invasive, but it's also incredibly precise. They basically thread a tiny, thin tube through the veins, right into the heart, and then into that pulmonary artery. Why? To measure the pressure directly at the source. No guesswork. And the result was just staggering. Her mean pulmonary artery pressure was 110. Now, to you and me, that number might not mean a whole lot. But to a cardiologist, that number is off the charts catastrophically high. Let me put that into perspective for you. A normal pressure in that artery is anything less than 20. Hers was 110. That's more than 5 times the absolute upper limit of normal. And with that, the diagnosis was crystal clear. Severe pulmonary hypertension, a really dangerous type of high blood pressure, specifically inside the lungs. And the other numbers told the same grim story. The resistance in her blood vessels, extremely high. The oxygen level in her blood was only at 85%. It should be 95% or more. That's why her skin had that bluish tint. And a measurement of how well her heart was pumping showed it was just struggling to keep up. So, okay, the diagnosis is in. Now, how on earth do you treat something this complex? The medical team came up with a really smart 3-part plan. The goal was to support her heart, help her breathe easier, and most importantly, bring down that dangerously high pressure. It was a multi-pronged attack, really. First up, supplemental oxygen. That's a direct way to get more oxygen into her blood. Second, non-invasive ventilation. Like a mask she'd wear at night to give her lungs some extra help, especially against the squeeze from the scoliosis. And third, and this is key, they used targeted medications called vasodilators. These are powerful drugs designed to do one thing, relax and open up those overworked blood vessels to try and relieve some of that crushing pressure. And you know what? It worked. This combined approach, tailored specifically for her, made a real difference. Her ability to just live her day-to-day life got better, and her oxygen levels went up. For a condition this complex, this was a huge win. So what's the big takeaway from this incredible story? Well, for the medical world, it's a huge reminder about something called diagnostic overshadowing. That's basically when one obvious condition, like scoliosis, can blind you to another, even more serious problem that's lurking underneath. The doctors who wrote about this case really hit the nail on the head. They said that when the symptoms just don't add up, when they seem way too severe for the diagnosis you think you have to dig deeper. Using advanced imaging and getting those precise measurements isn't just a good idea, it's essential. It can literally be the key that unlocks a life-saving treatment. And that just leaves us with one final thought. This whole case was a puzzle, right? But the most obvious piece, the scoliosis, turned out to be a red herring. It was a distraction from the real missing piece at the very center of it all. And it really makes you wonder, doesn't it? How many other complex conditions are out there, just hiding in plain sight, waiting for someone to look past the obvious and ask the right question?
The reference for the article from which this information was extracted is displayed on the screen. Thank you very much for your attention and for joining us until the end of this analysis. If you found this review helpful, we invite you to share it with colleagues, residents, students, and anyone interested in these topics. Don't forget to subscribe and turn on notifications. This material is for educational and scientific dissemination purposes only.